Hello, my name is Penny. I'm here in Bangalore, India after just having a bilateral knee replacement surgery. I kind of found my way here by living in the United States. I found myself with no insurance being able to cover my knees. I've suffered from severe osteoarthritis for quite a few years, started with one knee. And of course, after one knee, progressed to a second knee. This is something that is genetic in my family, which means it runs in the family. So it was nothing that I did, no injury, but it is a very painful condition. I got to the point where it was really severely affecting my life. The only thing I could do was try to be able to go to work and come home and try to relieve myself of the pain. And I got to the point where this was not what I wanted anymore, and I needed to find a way to have the surgery. Ironically, I actually work in surgery. I'm a surgical assistant for a group of surgeons, so I do understand the process. And I started to do some research, and I came across a term that's called medical tourism. And there are actually companies out there that will help you find somewhere to go out of the United States to have surgery. I had many options, Thailand, Singapore, Mexico, places in Europe, and also India was offered to me. And so I started looking at all the information they gave me. And the more I thought about it, I started focusing on India. Number one, working in surgery, I do know a lot of physicians and nurses that are from India, so I know that education over here is stressed very highly. Also, the other selling point for me about really considering India was that I know that at least 80% of the people here speak English, which was very huge for me because I knew I would be traveling alone. And I needed to be able to communicate because I understood there was going to be difficulties just because I was alone in this surgery. It's a big surgery, and I've never had surgery in my life, even though I've worked in surgery for quite some time now. I was put in touch with Dr.Arvind Patil by email at first. He had no idea what was to come. I sent him a copy of my x-rays and my x-ray reports, and I received word back for him that he agreed that I would be a good candidate for bilateral knee replacement. After that, I started to make the arrangements to come over here to the Apollo hospitals and have my surgery done by Dr. Patil. I boarded the plane. It was quite a long flight from the US. I wasn't really expecting that. But when I got here, there was somebody right there at the airport with an Apollo hospital sign to pick me up, bring me to the hospital. I was greeted by one doctor in charge of the international patient relations. So right away that told me that they were familiar with, they've dealt with a lot of international patients. I was there maybe 2 hours. Dr. Patil came into my room. We spoke. I felt very comfortable. I'm a big research person, and I would have never picked Dr. Patil if I hadn't already checked out his credentials. The company that sets things up like this, they are open book. They give you all the information you want to do. I knew that Dr. Patil had trained in the UK, and he had as good a training as any surgeon that I would know in the United States. So I felt very comfortable having Dr. Patil do my surgery. They got me settled into the hospital, and within 24 hours I was in surgery having my first knee done. Dr. Patil does not do both knees at the same time, which is fine. He does what he calls a staging procedure. 4 days later, we did my second knee, and I am now only not quite 3 weeks. I'm out of my braces, and I'm walking with a walker. Rehab, it's been going well. There's good days, there's bad days, but I have no regrets at all about coming here to have my knee replacement surgery. I would like to say that I think The care that I received in the hospital was as good or maybe even better as far as hands-on wise with the people at Apollo. The problem that I find in the United States these days is they are so focused on computerized charting and information that sometimes patient care gets put to the side, the hands-on patient care. While I was here, Dr. Patel visited me twice a day, every day, and if he couldn't come, he made sure that his associate was there. So I never saw him less than twice a day. There were many other doctors that came to visit me to make sure that I was okay. The care I received directly after surgery in their ICU unit was first rate. The sisters, nurses on the floor were all wonderful. We became very close, more than just nurses. I feel like they're my friends now. I think they thought I was just a crazy American woman when I first got here, but we all got to become very good friends, and I think that we've left a lasting impression on all of our lives. So even though I'm missing home, I don't regret for 1 minute coming here to have my surgery, and I really look forward to continuing with a wonderful life back at home. Once my knees are fully functional again, I feel I'm going to have no limits to being able to go back to work or anything else I did before. So I'm so glad and thankful to Dr. Patel and all the staff at Apollo Hospital for taking care of me the way that they have. I must say that even though Dr. Patel can put perfect implants and make your legs perfect again, one thing that is important is that you do rehab and rehab and rehab. And I have to give a big mention to Praveen, the physiotherapist. He's absolutely wonderful. He always has a positive attitude. He always gets you motivated and you want to do the rehab for him. So I really give a big shout out to him for getting me this far, and Dr. Patel for doing a wonderful surgery on my knees. So Praveen, thank you very much.